In this video, I'm going to use a model to show you the difference between piriformis syndrome and sports hernias. Hey everyone, I'm Sebastian at Performance Based Sports Care, part of locally world-famous chiropractors in Costa Mesa, California. Now in this video, I'm going to use the model to give you a better idea of what each condition is and how they're different from each other, but also the history in presentation, signs and symptoms are actually very important for separating these two apart. Now, to be fair, many of you are probably looking for things like self-test on YouTube. What can you perform on yourself to figure out what you have, or where do you need to touch to figure out what you have? This is not necessarily how it works. Usually combining information with what provokes it, where you feel things, as well as a bunch of tests give us a better idea of how to actually identify what's going on with you. We rule things in and we rule things out based upon the information you have, but there is no one single test that will tell you what you have. So keep that in mind as we go through this today. Now, let's start with a sports hernia. A sports hernia, generally the presentation is on the front of the hip here, okay? It is not the only thing that creates front of hip pain, but most people will feel it in this area. Some people will feel it directly into the pubic bone. The pubic bone is the one that you feel down in your belly and you get to a bony spot here. That is the pubic bone. Right in the center is the pubic symphysis, which is an actual joint, okay? A lot of times the belief is that the sports hernia is mainly created by the hip not functioning well, which puts excessive load on the pubic symphysis, which creates tenderness of some of the things that come off of it, like the adductor tendon. Many of you will have tenderness in the adductor tendon, which feels like a rope right here. Some of the tenderness will go all the way down into part of the thigh, but it won't go past the knee. If it goes past the knee and down into the shin or into the foot, where it feels like it's directly related to your knee pain, you have something else going on, and we can help you with that too, but it's not this, or it's probably not this. Most of you will feel some tenderness up from the crease hip too. We would call that the lower abdominal region. Sometimes people will feel tenderness onto the side, right around the crest of the hip, and sometimes into the SI joint region, right about here. It's just tenderness over the location. It does not indicate that you have SI joint dysfunction or any type of bone that's out of place. It just is it's a common thing that we see. Some of you, if you're men, you'll feel testicular tightness. I've heard that women will have a similar presentation into the genital region as well. There's reasons why this happens based upon the local anatomy, but it's a very common thing that people will feel. Now, piriformis syndrome is a little bit different, and you may have almost like a flip-flop of dominance in your presentation. Most of you will have pain into this region to start. It'll feel like you push down on it and it increases your symptoms dramatically. It's super tender. Some people will feel problems down into the leg here, into the back of the thigh, while some of you will feel it down into the back part of the calf or even into the foot. To be fair, this does not indicate piriformis syndrome either. While you could have something like a low back problem, creating something like radiculopathy, which creates the symptoms of leg pain. Many of you may be thinking, well, maybe I have sciatica. Well, maybe. Sciatica is a symptom, not a diagnosis. Sciatica means leg pain. And so leg pain is created by things like piriformis syndrome, as well as lumbar radiculopathy, which can be from a disc herniation, disc protrusion, or other types of disc injuries, as well as something like foraminal stenosis, which is just a narrowing of a hole. Sometimes people with the groin or with the piriformis type of pain or tenderness back there will feel problems into this region here, but it's not super aggressive. Most of the time they'll feel it into the backside there and a little bit more down the leg, but this comes sometimes as a secondary complaint. Notice how the two things kind of flip-flop. One has a dominant presentation in the front while a little bit in the back, and the other one has a dominant presentation in the back and a little bit in the front. That's the first difference between the two if we're going to pick between one or the other. The things that bother it tend to be a little bit different. Things that bother piriformis syndrome is direct pressure to the region, like sitting on a wallet, even things like bending forward, like you're going to actually touch your toes, tend to bother it, while something like a squat may hurt things in the front like a sports hernia, or things like twisting, things that pin the foot or the knee to the ground. They're stretching the adductor, which stretches the interface between the two. Okay. Now, if we're talking about local anatomy of the area in these models, the piriformis is one. So this is the front side of the hip. This, or the pelvis, the front side of your body. This is the side of the hip. This is the bony bone that some of you lay on that's it's just tender. And then we have the back side here. This is the gluteal region. All right. The glute max has been removed from this model. And then there's the glute medius, there's the glute minimus, there's the piriformis, and some of the other rotators of the hip. Okay. The sciatic nerve does come down through this area, and it goes underneath or through the piriformis, and it travels on down the leg a little bit, which can explain why sometimes people with piriformis tenderness or piriformis syndrome can have leg pain as well, but not everybody will. All right. But this is the muscle in question, which typically is tender on people. While with a sports hernia, there's actually nothing on this model which is a symptom generator. I'm not going to say they're not parts of the problem, because most of the time a lack of hip joint function, which also has hip musculature problems, and also has core problems and pelvis problems, and there's other problems associated with it, but the actual symptom generating structure is nowhere on this model. Okay. Now, if we look at this other book, we get a better idea of what potentially could be creating the symptoms. Actually, I take it back. One thing, there is one thing on this model which possibly is symptom generating structure. It's right here. It's the symphysis. All right. It's the mated pair of this thing. It joins in the front right around there, and so the shear force, the rotation at that, which is excessive in people with sports hernias, tends to create a little bit of local sensitivity around the area. And that's only if you have pubic bone pain. Now, in this picture, there's the white area, which is all the fascia. It's called the aponeurosis, right into this region here. Remember, this is not an abdominal hernia. It's a sports hernia, which is not a hernia. It has nothing to do with abdominal contents. It's a completely different problem. So the area, this fascia, is what tends to become compromised, and it ends up being torn or frayed, which is what they tend to confirm on the imaging. Now, if you're dealing with something like this and not quite sure what it is, you should honestly just be examined and work with someone one-on-one. I've met a lot of people who try to deal with this on their own. Some are successful and some aren't. I've met people who have been dealing with this for weeks, sometimes years. Typically, a healing time for something like this is generally within about 3 to 4 months, all right? A lot of people can have a significant reduction of pain within even a matter of a couple weeks. But if your goal is to get back to an active lifestyle, you need to make sure that you reduce the pain, build in a little bit of support via doing the right corrective exercises and the right stretches, and also loading the entire limb again. The mind-boggling thing is a lot of times people with these two conditions tend to actually take a lot of time off, months and months and months off, and they go play a whole soccer game or a whole baseball game or a whole football game, and they expect their body to be in the same shape, and it's not. You've deconditioned the entire body to let one area start to heal itself. And so a lot of times what people don't know is they can actually do a lot of rehabilitation, a lot of a challenging activity, and it's encouraged to keep the rest of the body whole and functioning while you're letting one area settle and you're building up support around that area. So if you guys are looking for help, we're in Costa Mesa, California. We see people virtually for both of these problems. We've seen people for piriformis sensitivity or syndrome or tightness. We've seen people for sports hernias virtually as well. And generally it tends to go really well. All we have to do is assess your movements, figure out some of the history, some of the information, and do some of the testing. We can coach you through it here, or we can do it in person. All of our contact information is below. Reach out. We'd love to do a consultation with you and figure out if we can help you at all. Subscribe to the channel. We have a lot more videos just like this on this topic on YouTube. See you later.